we need a monitor now. I need to check his heart rate.
We don't have that type of equipment. Just keep checking his hands.
This isn't working. We don't have the right equipment.
What you just saw is what nursing might look like without technology, and that is exactly why technology matters. And today, I want to explore the question of how is technology positively impacting the work and efficiency of nurses in the healthcare field. Growing up, most of my family have been involved in the medical field, and I've truly been influenced, which is why I've chosen nursing as my topic for this 20% project. Technology helps nurses take better care of their patients, faster, safer, and more accurately. Electronic health records can help nurses access the patient's info in real time. Smart beds can monitor the patient so that the nurses can also do other tasks. One that I think is really important are vital sign alerts. These ones can alert the nurses when something is wrong even before the patient speaks up. As Mary Joy Garcia-Dia explains in her article, Balancing Care of Technology, nurses can maintain compassionate care while using high-tech tools to support safer outcomes. What really stood out to me while reading the article is when she said that the technology isn't supposed to replace the human care, but to help enhance it. Nurses have so much to take care of, and I'm sure that it gets really stressful, but luckily with the technology that we have today, their stress can go away. For example, barcode scanning can reduce medication errors, portable charting helps nurses change their patients' records from wherever they are, and telehealth is when a nurse can assist a patient through a video call or just through a screen. In the book Empowering Nurses with Technology by Kathleen McGrow, she breaks down many different technology systems and how they work and why they matter. And it really helped me understand that these technologies aren't just cool gadgets and that they're carefully designed to reduce mistakes, save time, and protect both patients and nurses. Her explanations helped me picture what a high-tech nursing workflow actually looks like. This technology isn't just used for current nurses, but it's also used for nurses in training. Now they can use these virtual training simulators, which can really help them visualize what they'll be working with in their future career. Most of these training procedures have been thought of by actual nurses, which is why it's important for nurses to speak out on their ideas and thoughts. In the TED Talk Bridge the Gap, Let Nurses Innovate by Ben Gran, he talks about how nurses are constantly coming up with these new ideas to improve their work. Gran also talked about how nurses are often the ones coming up with these creative tech solutions because they're the ones closest to the patients and they know what's best for the patient and for them. This connected to my research because it showed me that technology and nursing isn't just learning how to use these machines, but it's also about using their problem-solving skills. Today, I'm here with my mom, Natalie Campos, who's been working as a nurse in the operating room for 18 years. I wanted to ask her a few quick questions about how technology has changed her job since she's actually out there doing it every single day. My first question is, how does technology help you give better care to your patients?
Technology has been a huge aspect in the medical field. Back in the day, we'd be checking pulse, blood pressure manually, but now with technology, everything is done by machine. And also, digital charts are a lifesaver. It gives us more time to focus on care to our patients.
That's interesting. That actually brings me to my next question. Has any tech tool made your job easier or saved you any time?
Yes. So, for example, scanning the barcode for the things that we use for a procedure. Years ago, we just manually write it on a paper, which takes a lot of time. But with the technology now, it's faster, easy, and we have more time observing the team and the patient during the operation.
I can see how that can help a lot. My last question is, do you think technology has made nursing safer or more accurate? Why or why not?
Yes, it made it safer. For example, I'm going to be talking about the barcode scanning again because especially for us giving meds, we just scan the patient's wristband, we scan the drug, and you know that it's right. Technology is not perfect. It can crash at worst times, but it's like a safety buddy that always got our back in our profession.
That's actually all the questions that I had, so thank you so much for answering them. Reflecting back on my mom's interview, it made all the information from the books and articles seem more realistic. Carrie Rubin's article, Embracing Technology in Nursing, helped me understand that digital tools like electronic records, mobile devices, and data systems aren't just making things faster, but they're actually helping nurses connect more deeply with their patients. At first, I thought that the technology might replace humans' jobs, but in fact, it just helped to make it even better. Thank you for watching, and I hope that you learned something new just like I did.